Okay, so tennis elbow is a condition where you're getting some pain right here in the lateral elbow. This will be usually with gripping. Sometimes it is with sports like tennis, but honestly 95% of the time people get tennis elbow, it's not from playing tennis. People will say, oh, it's because I'm typing so much or whatever, but the truth is, like, you should be able to type as much as you want without feeling pain in your elbow. So there's usually something kind of underlying that's going on. When you come in to get assessed for tennis elbow, we're going to look for a couple of key things, like, do you get pain reproduced when you push down on your index knuckle? Or do you get pain reproduced when we kind of push down from this position here? Is that pain like up in this location right over here? And those are usually like fairly definitive tests for actually telling us this is the condition, and start to get an idea of like which muscles are specifically producing the pain. We need to think further about like what's actually causing those muscles to be so irritable and treat other things, sometimes up as far as the neck. When it comes to treating locally, one of the treatments we can do is IMS. IMS, we're just going to try to identify where those muscle fibers are. So for extensor carpi radialis brevis, which is a muscle that comes right down to this part here, and if you're getting pain in this test, we're going to kind of look for that right here. And if we find a tight band of tissue in there, we can do things like massaging it or rolling it with a lacrosse ball. We're also going to do things like IMS, where we can actually target that specifically, try to locate it under my fingertips and then tap the needle in. And the idea is to reset some of that tension, help you to decrease your tension. The interesting thing about these ones, sometimes we'll actually see the fingers kind of pop up, right? Like middle finger, or we'll see that tendon in the wrist when we're needling. We're trying to identify that with my fingertips here first, just feeling for like where is that ropey band in the muscle, and then do we see any of that kind of activity down here? There we go, a little bit of a twitch in the tendons. So it's really suggesting there's quite a bit of tension right there, and we'll see if we can find it with the needle. After that, we'll look for another one. So the muscle that does this, extending the middle finger, that's the other one that's usually mainly responsible for some of these symptoms. We're going to try to locate those bands of tissue, and we can tap the needle in there. And the goal again is to reset some of that tension. Oh buddy, there we go.
That was a big one.
We've had clients, I had one client one time who said, I bumped into him in the street maybe 3 years after treating him, and he came for only one appointment, and I was like, oh, like how are you doing, whatever, how's that tennis elbow? And he was like, the IMS actually fixed it in a single session. And I was like, oh, that's great, because I thought, maybe you came and you didn't really like it or something, you just didn't come back. But he actually said it was done so quickly, it was so effective. We're not always looking for something that effective or promising that, but something that's really neat about it is that we'll often see an improvement in your grip, like pain with gripping immediately. So we'll often use that like grip test, retest, where are you getting your pain, and then maybe we'll tap in a needle right there where you're kind of pointing to. Okay, now try it, and you're like, okay, I'm not feeling it here so much, and now I'm feeling it here. So we can actually kind of like pursue those muscles step by step throughout the treatment, and then see that kind of sequential improvement in your ability to produce force and do that without pain.